Strep throat is a common bacterial infection that affects the throat and tonsils, causing symptoms like sore throat, fever, and swollen lymph nodes. Diagnosing strep throat accurately is crucial because it helps guide appropriate treatment and prevents complications. In this video, we'll explore the most commonly used tests for evaluating strep throat, how they work, and what you can expect during the diagnostic process. Let's begin by understanding why testing is important and what symptoms might prompt a healthcare provider to order these tests. Testing for strep throat is essential because its symptoms can overlap with those of viral infections, which do not require antibiotics. Accurate diagnosis ensures that antibiotics are only prescribed when necessary, reducing the risk of antibiotic resistance and unnecessary side effects. It also helps prevent complications such as rheumatic fever, which can occur if strep throat is left untreated. Understanding the importance of testing sets the stage for exploring the specific tests used to diagnose this condition. Healthcare providers typically consider testing for strep throat when patients present with symptoms such as a sudden sore throat, pain when swallowing, red and swollen tonsils, white patches or streaks of pus, tiny red spots on the roof of the mouth, and swollen lymph nodes in the neck. Fever, headache, and rash may also be present. These symptoms help differentiate strep throat from other causes of sore throat and guide the decision to perform diagnostic tests. There are two main types of tests commonly used to evaluate strep throat: the rapid antigen detection test, RAD, and the throat culture. Each test has its own advantages and limitations, and the choice of test may depend on the patient's age, symptoms, and clinical setting. Let's take a closer look at how each of these tests works and what you can expect during the testing process. The rapid antigen detection test, or RADT, is one of the most widely used tests for diagnosing strep throat. This test detects the presence of antigens from group A Streptococcus bacteria in a throat swab sample. The main advantage of RADT is its speed results are usually available within minutes, allowing for quick decision-making regarding treatment. However, while RADT is highly specific, it may not be as sensitive as other methods, meaning false negatives can occur. To perform a rapid antigen detection test, a healthcare provider uses a sterile swab to collect a sample from the back of the throat and tonsils. The swab is then processed using a special reagent that reacts with strep antigens if present. The test kit provides a visual result, often similar to a pregnancy test strip, indicating whether group A Streptococcus is detected. The entire process takes about 10 to 20 minutes. A positive RADT result means that group A Streptococcus antigens were detected, confirming a strep throat diagnosis and supporting the use of antibiotics. A negative result suggests that strep bacteria are not present, but because the test can sometimes miss infections, a follow-up throat culture may be recommended, especially in children or high-risk patients. This approach helps ensure that cases are not missed and that treatment is appropriate. The throat culture is considered the gold standard for diagnosing strep throat. This test involves swabbing the throat and tonsils, then placing the swab on a special culture medium that encourages the growth of group A Streptococcus bacteria if present. Although it takes longer to get results, usually 24 to 48 hours, throat cultures are more sensitive than RADT and can detect infections that the rapid test might miss. To perform a throat culture, a healthcare provider gently swabs the back of the throat and tonsils, just as with RAD. The swab is then streaked onto a culture plate and incubated in a laboratory. If group A Streptococcus bacteria are present, they will grow and form visible colonies, which can be identified by laboratory staff. This process ensures a highly accurate diagnosis, even in cases where the rapid test is negative. Throat cultures are highly sensitive and can detect even small amounts of group A Streptococcus bacteria. This makes them especially useful in cases where the rapid test is negative, but clinical suspicion remains high. The accuracy of throat cultures helps prevent misdiagnoses and ensures that patients receive the right treatment. However, the main drawback is the longer wait time for results compared to rapid tests. While throat cultures are very accurate, they are not without limitations. The main disadvantage is the time required to obtain results, which can delay treatment decisions. Additionally, the process requires laboratory facilities and trained personnel, which may not be available in all healthcare settings. Despite these challenges, throat cultures remain an important tool for confirming strep throat, especially in children and high-risk patients. The choice between RADT and throat culture depends on several factors, including patient age, risk of complications, and availability of testing resources. In many cases, a rapid test is performed first due to its speed. If the result is negative, but suspicion remains high, especially in children, a follow-up throat culture is recommended. This approach balances the need for quick results with the importance of diagnostic accuracy. In some cases, healthcare providers may use clinical scoring systems, such as the Centaur criteria, to estimate the likelihood of strep throat before testing. These systems consider factors like fever, absence of cough, swollen lymph nodes, and tonsillar exudate. While helpful, these scores are not a substitute for laboratory testing, but they can guide decisions about whether to test or treat empirically. Clinical judgment remains an important part of diagnosing strep throat. Experienced healthcare providers consider the patient's history, symptoms, and risk factors when deciding whether to test and how to interpret results. This individualized approach ensures that testing is used appropriately and that patients receive the most effective care based on their unique situation. To summarize, the evaluation of strep throat typically begins with a clinical assessment, followed by a rapid antigen detection test for quick results. If the rapid test is negative, but suspicion remains, a throat culture is performed to confirm the diagnosis. This stepwise approach ensures that patients receive timely and accurate care, reducing the risk of complications and unnecessary antibiotic use. The first step in evaluating strep throat is a thorough clinical assessment. The healthcare provider asks about symptoms, examines the throat and neck, and checks for signs such as redness, swelling, and pus on the tonsils. This initial evaluation helps determine whether further testing is needed and guides the choice of diagnostic tests. If testing is indicated, the next step is collecting a throat swab. The provider uses a sterile swab to gently rub the back of the throat and tonsils, avoiding contact with the tongue and cheeks. Proper technique is important to ensure an adequate sample is obtained for accurate testing. The collected swab is first used for the rapid antigen detection test. The sample is mixed with a reagent and applied to the test device. Within minutes, the device indicates whether Group A Streptococcus antigens are present, helping guide immediate treatment decisions. If the rapid test is negative, but clinical suspicion remains the same, or a second swab is used to perform a throat culture. The swab is streaked onto a culture plate and incubated in the lab. This step ensures that cases missed by the rapid test are still detected and treated appropriately. Let's visualize the stepwise process of evaluating strep throat. It starts with a clinical assessment, followed by a rapid antigen test for quick results. If the rapid test is negative, a throat culture is performed to confirm the diagnosis. This flow ensures that patients receive timely and accurate care. The rapid antigen detection test is highly specific, meaning a positive result is very reliable. However, its sensitivity is lower than that of throat culture, so some true cases of strep throat may be missed. This is why negative rapid test results in children are often followed by a throat culture to ensure no cases are overlooked. Throat cultures are the most sensitive test for detecting Group A Streptococcus. They can identify nearly all true cases of strep throat, making them the gold standard for diagnosis. However, the longer turnaround time means that treatment may be delayed until results are available, especially in settings where rapid testing is not available. In children, the risk of complications from untreated strep throat is higher, so guidelines recommend confirming negative rapid test results with a throat culture. This approach ensures that no cases are missed and that children receive the appropriate treatment to prevent complications like rheumatic fever. For adults, the risk of complications is lower, and a negative rapid antigen test is often considered sufficient to rule out strep throat. Throat cultures are usually reserved for special cases or when clinical suspicion remains high despite a negative rapid test. This approach helps avoid unnecessary testing and antibiotic use in adults. Rapid antigen tests are often performed at the point of care, such as in a doctor's office or clinic. This allows for immediate results and timely treatment decisions. Throat cultures, on the other hand, require laboratory facilities and may not be available in all settings, especially in remote or resource-limited areas. Rapid antigen tests are generally less expensive and more accessible than throat cultures, making them a practical choice for many healthcare settings. However, the higher sensitivity of throat cultures justifies their use in cases where accuracy is critical, such as in children or high-risk patients. Patients undergoing strep throat testing can expect a quick and relatively painless procedure. The throat swab may cause mild discomfort or a gagging sensation, but it is over in seconds. Results from rapid tests are available quickly, while throat culture results require a follow-up call or visit. Strep throat testing is very safe, with minimal risks. The most common side effect is mild throat irritation from the swab. There is no risk of infection from the test itself, and complications are extremely rare. Patients can resume normal activities immediately after testing. After testing, if strep throat is confirmed, the healthcare provider will prescribe antibiotics to treat the infection and prevent complications. If the test is negative, other causes of sore throat may be considered, and treatment will be based on the underlying condition. Follow-up may be needed if symptoms persist or worsen. While testing is important for diagnosis, prevention is always better than cure. Good hand hygiene, avoiding close contact with infected individuals, and not sharing utensils or drinks can help reduce the risk of getting strep throat. Early testing and treatment also help prevent the spread of infection to others. If strep throat is left untreated, it can lead to serious complications such as rheumatic fever, kidney inflammation, and abscess formation. Prompt testing and treatment are essential to prevent these outcomes and ensure a full recovery. Accurate testing for strep throat supports antibiotic stewardship by ensuring that antibiotics are only prescribed when truly needed. This helps combat antibiotic resistance and preserves the effectiveness of these important medications for future generations. To recap, the most commonly used tests for evaluating strep throat are the rapid antigen detection test and the throat culture. Each has its own strengths and limitations, and the choice depends on patient factors and clinical setting. Accurate diagnosis ensures appropriate treatment and helps prevent complications. The rapid antigen detection test is a diagnostic tool that quickly identifies the presence of group A Streptococcus antigens in a throat swab sample. It is valued for its speed and specificity, making it a popular choice in clinical settings where timely results are important. A throat culture is a laboratory test that involves growing bacteria from a throat swab on a special medium to identify group A Streptococcus. It is the gold standard for diagnosing strep throat due to its high sensitivity and accuracy, despite the longer wait for results. The Centaur criteria is a clinical scoring system used to estimate the likelihood of strep throat based on symptoms such as fever, absence of cough, swollen lymph nodes, and tonsillar exudate. It helps guide decisions about testing and treatment, but is not a substitute for laboratory confirmation. Antibiotic stewardship refers to the responsible use of antibiotics to minimize resistance and preserve their effectiveness. Accurate strep throat testing ensures that antibiotics are only prescribed when necessary, supporting this important public health goal. Group A Streptococcus is the bacterium responsible for causing strep throat. It can lead to a range of illnesses, from mild throat infections to serious complications if left untreated. Identifying this bacterium is the main goal of strep throat testing. Rheumatic fever is a serious complication that can occur if strep throat is left untreated. It can affect the heart, joints, and other organs. Prompt diagnosis and treatment of strep throat are essential to prevent this potentially life-threatening condition. Sensitivity and specificity are key concepts in diagnostic testing. Sensitivity refers to a test's ability to correctly identify those with the disease, while specificity refers to correctly identifying those without it. Rapid antigen tests are highly specific but less sensitive than throat cultures. Point-of-care testing refers to diagnostic tests performed at or near the site of patient care, such as in a clinic or doctor's office. Rapid antigen tests for strep throat are a prime example, providing quick results that facilitate immediate treatment decisions. Clinical judgment is the process by which healthcare providers integrate patient history, symptoms, and test results to make informed decisions about diagnosis and treatment. It plays a critical role in the evaluation of strep throat and the selection of appropriate tests. Complications from untreated strep throat can include rheumatic fever, kidney inflammation, and abscesses. Early and accurate testing is essential to prevent these serious outcomes and ensure patient safety. Prevention of strep throat involves good hygiene practices, avoiding close contact with infected individuals, and early testing and treatment. These measures help reduce the spread of infection and protect both individuals and communities. In conclusion, evaluating strep throat relies on a combination of clinical assessment and laboratory testing, with the rapid antigen detection test and throat culture being the most commonly used methods. Understanding how these tests work, their strengths and limitations, and when to use each one is essential for accurate diagnosis and effective treatment. By following best practices in testing and prevention, we can ensure better health outcomes for everyone.